Hi, this is Dr. Jennie Byrne, Cognitive Psychiatry of Chapel Hill. Today I wanted to talk a little bit about how I treat patients for memory loss here at Cognitive Psychiatry, because it's a question I get asked frequently, and the way we do things here is a little differently than perhaps other doctors might do. So when we think about memory loss, the first thing that jumps to most people's minds is Alzheimer's disease or Alzheimer's dementia. And that is a common form of dementia, but it is certainly not the only type of memory loss problem that a person could have. So one of the things I do here at the practice is to help people understand where their memory loss is coming from. And this is not always dementia. So sometimes memory loss can be caused by medications, by medical illnesses, by other brain processes. It's not always a dementia process. So the first thing I do is try to help them understand where their memory loss is coming from. And perhaps they've already been seen by other doctors, other neurologists, and maybe they already have a diagnosis, but they still need some help in understanding what the memory loss is about and what to expect. Then another really important part of what I do here is to help people who have memory loss understand what to expect in the future, because this is a source of a lot of anxiety for people. When they don't know what to expect, it can make them very anxious and upset and cause their memory loss to get even worse because of the anxiety. So we spend a lot of time talking about the memory loss, what that means to the person, how is it going to change their life, how is it not going to change their life, what to expect when they go to the hospital for procedures, etc. So not just the idea that they do have memory loss, but how does it actually affect their day-to-day life? And I think most people who work with us here find that, even though they do have memory loss, they are able to still do a lot of things and have a very fulfilling life. So it helps remove some of the stigma and shame and worry and fears that people have surrounding memory loss. Another important thing I do here at the practice is to help treat some of the anxiety, depression, or even psychotic symptoms, which are hallucinations and delusions, things like that, to help treat these psychiatric symptoms that can accompany memory loss. So, for example, if somebody is very, very depressed, I try to understand, is it part of the memory loss brain issue, or is it a separate issue of depression, or is the depression something maybe they've had all their lives? And treat the depression, treat the anxiety, because we know that if you treat the depression, anxiety, the memory is going to do better than it would otherwise. So in other words, if you're having a lot of anxiety, if you're having depression, whatever memory problem you're having is going to get a lot worse. So we really have to take care of that. And one important thing to keep in mind is that doesn't always mean medication. Sometimes medication is the best treatment option for anxiety and depression, but sometimes it's not. Sometimes taking medicine off can be helpful. Sometimes doing psychotherapy can help. Sometimes having some family sessions where a spouse or a caregiver comes in the room and we really talk about how this is affecting their lives and how they feel. So it's not always medication that's the answer here. And then finally, another thing I often do with patients is we really talk a lot about lifestyle things that they can do to preserve the memory they do have. So for example, things like sleep, things like socializing, things like getting out and learning new things, diet, exercise is a big one. These are kind of some lifestyle things that people can do to help preserve the memory that they do have. So I work a lot with patients on understanding some lifestyle changes that they can make in addition to the medicine, in addition to therapy, in addition to all the other things they're going to do to try to work on their memory. So again, this is a little different. I think most people think of a psychiatrist or neurologist as just being a diagnostician where we understand the diagnosis and then we take out our prescription pad and we start writing medications. And that's not really a very holistic approach to the problem. Really listening to someone who's going through memory loss, helping them to understand it, how it's going to affect their lives, and then kind of plan for the future tends to provide people with a lot of relief, and it makes a huge difference in their lives. if they're able to do this. So I hope this has been helpful, and if you or someone that you love has memory loss and you think would benefit from a consultation, please just give us a call and let us know how we can be of help. Thanks. Bye-bye.